Today, I'm going to talk to you about what obesity really is and why it's bad for you. So before you tackle any problem, you have to understand it and the nuances around it. Most people think they know what obesity is, but they really don't know what it is. And if you don't really know what the disease is, how are you going to treat it? How are you going to do anything about it? And it's this critical issue that's sort of been missed by lots of people along the way. Maybe the doctors you've seen in offices, maybe the people you run into on the street, or maybe even your own family members. Fortunately, there's a lot of shame and blame like within families, and all of it's got to stop. But that's what we're here for. That's what we're going to do. So, I'm Dr. Evan. We didn't talk about that. I'm the leading pediatric bariatric surgeon in the country, and I've been taking care of patients with obesity for over 20 years. So thanks for tuning in, and hopefully you learned something. Hopefully we grow together. So obesity is what's called a phenotype, and that's a fancy medical term. But what it means is how something looks, right? And so we all think we know what obesity is because you can look at somebody and say, that person is struggling with their weight, right? Sort of a double-edged sword because it's a disease. You know, you can't hide your disease. I can't look at you and say you have thyroid disease or diabetes or something else, but everybody can see if you're struggling with your weight. And because everybody can see it, they think they know what's best for you, right? They'll tell you, this diet worked for me, you should try it. Or why don't you just do some more exercise? Or why don't you just stop eating at the takeout mom and pop store on the corner or whatever. So like, it's one of those, people don't come up to you and say, well, why don't you try this drug for your thyroid disease because, that worked for me, so it's just one of those diseases that people think they can share their opinion on when probably it's not really wanted most of the time. So the key thing about obesity is that even though it looks the same on the outside, it comes from a bunch of different possible pathways on the inside. And those are called genotypes, but you don't really need to know that. But just know, it's kind of like don't judge a book by its cover. Just because somebody looks like they have weight issues, you have no idea why they have weight issues. Maybe it's because their genes have been passed on from generation to generation, and they really had no chance of being normal weight at all. Or maybe they had brain surgery. Believe it or not, there's a brain surgery that can result in people gaining a whole lot of weight. Most folks don't know that. And people actually think that obesity is like a new problem, like it just started when food started to get processed and fast food became a thing. But actually, obesity's been around for at least 80 years and probably longer. In fact, I'm a surgeon, right? So I'm interested in doing surgery for weight. And the first report in the medical literature about weight loss surgery was in 1946. So that's 80 years ago. And they had 90 patients in their series. So it's part of the normal human condition. And we got to get over the stigma and the bias around it so that we can actually just deal with it. So for you as an individual, if you are suffering from obesity, you want to know how best to treat it. Well, in order to know how best to treat it, you got to know sort of why you're there. And we will talk about the different medications that are now available. And we will talk about the different surgeries. And there are some people who need medication. There's some people who need surgery. There's some people who need both. There are some people, a relatively small number, but a few people who can diet and exercise their way from the disease. And if you've ever watched The Biggest Loser, which I know hasn't been on TV for a while, and it probably dates me as an old guy, but that was a TV show where these people basically were in boot camp for months and they lost a ton of weight, and it sort of made everybody think that that's all you needed to do to lose weight. The secret behind that TV show is that most of those people gained their weight back after the show ended because no one can really live that way. So, as a whole, the society, we got to stop focusing only on prevention and start talking about treatment. And obesity treatment really is the best obesity prevention. And, health and weight aren't necessarily inextricably linked, but they do go hand in hand for lots of folks. And so we need to figure out as a society really about your metabolic health and how to measure that and what you can do about it. And then again, just sort of get on with taking care of the disease, because all this other bias and stigma and telling people what they should do and not really just treating them as a human patient isn't helping anybody. So I'm gonna say over and over again, remember, obesity is a disease and not a lifestyle choice, and that you can do something about it. In the next episode, we're gonna talk about the different causes of obesity. And if you like what you're hearing today, tune in next time. And also send this link to your friends, to your family, to whomever. Remember to like and to comment and all those other things that can help me learn from you what we want to do next. So see you next time.